dive deep into the framework that I've been using across several research projects here in the College of Health Solutions and beyond, like with Tayo in the Edson School of Nursing, and even with community-based organizations outside of ASU. We even reached Austin, Texas with this framework. And then I'm gonna really focus on one project that's the ongoing project now, which is about breast cancer in Mexico. So what's happening what's the problem? As you know, digital health is becoming so rapid in expansion, and technologies left and right. So if you even look at funding, federal funding, they're always pushing for thinking that they're going to solve the health inequity by having digital health more approachable and accessible for people. But there's a big issue happening that it's fast, it's going fast, it's expanding, but they're not including the community knowledge and lived experience in the design processes. So in other words, what we're doing is we are carrying on the same gaps, the same health disparities while we're building these technologies at a fast pace. Then this leads, when we leave out the community members' experiences and knowledge, then we see a persistent mismatch between technological solutions and real-world contexts, which leads as a result to suboptimal adoption, very low engagement with the intervention digital health, and no sustained impact. Now, why co-creation is important? I'm not lecturing you. I'm just telling you what I have learned myself. We all know the more we collaborate together as team, it leads to better results. We have seen this even with traditional way of doing research and even designing things. But we need to remember when it comes to digital health, why it's specifically important to do a co-creation process by including the end users as collaborators and co-creators throughout the life cycle of the digital health development. First, I want to say it transforms users from passive informants into active partners, enhancing their engagement. Not only engagement, it's compliance as well. So they feel ownership. We built it with you. We really contributed with our needs, assets, and strengths. So they feel like it really reflects their daily lives, and the adoption becomes easier, and engagement and sustainability even. It ensures behavior change, since when they see it's reflecting their needs and strengths and their lived experiences. As I said earlier, it enhances engagement, and this leads to whatever we're aiming in this digital tool, to leading to the behavioral change we're trying to achieve through the innovation. It prevents costly downstream failures, such as poor adoption and mismatched features. So when we build something, we test the prototype without engaging the community from the beginning. We take it, we test the prototype, we come, but still, it is something that was done for the community, not with the community. So a lot of pieces are still missing. And when we won't go to implementation, then the mismatch happens. Then you need to take a step back and redo a lot of stuff. And that costs a lot of money. And of course, time consuming and low impact for the outcomes we're aiming for. The other thing about co-creation, it democratizes innovation by amplifying diverse voices and reducing health disparities. By including community members as partners in research, as co-creators, this really addresses the health disparity that we've been seeing affecting our healthcare system and health research as well. The last point I want to mention here, it supports health researchers in designing evidence-based, community-grounded interventions. So it also improves the work of the researchers in this space. The next slide is about co-creation methods. So there are multiple various tools out there, depending on where the development of the digital tool is. If it's in an early stage, we know there's a set of methods recommended. If it's mid-stage, another set is recommended. I'm not going to talk about these examples, the hackathon versus this and versus that, and also the later stage. But today the focus is, I'm going to talk about the framework we've been using here in Precision Health Research Initiative. It's called the Design Studio for Health. that really fits all the stages. You can use it at any stage of the development of the digital tool that you're building with the community. Why I really love this framework? Because it is equity centered. It uses human centered methods. It's community-based participatory research. It's iterative, and it really flattens the hierarchy. So when we really build the session, we work on really making people equal around the table by assigning the roles, for example. So in the next slide, I'm going to tell you what we do before even coming to the session. So power hierarchies are really flattened in this framework, and the health context adaptation is tailored because it goes through a lot of iterative sessions to get to what we're aiming for at the end with the community partners. And as I said, it's collaborative, it's co-creation rooted in human-centered and participatory design. So basically, the design studio for health, this is a graph we tried to capture the whole story behind the framework. So if you see, can you see my cursor? So we start here, for example, first, we engage with the community without a research health topic. So this is very unusual for the traditional way of doing research. We usually, for example, Stephanie is an expert in this area, Maissa is expert in that area. So we go find funding, and then we come to the community and tell them, how can we work together? In this case, what we do is we engage with the community to see what priorities they like to work on. So they identify one or two health topics that they want to address as a community. And then we go back and then we see what funding is out there to allow us to come and co-build together. So we engage with the community sometimes 2, 3, 4, 5 times before even understanding where to start and what is the health focus that we're going to be working on. So after this engagement, we identify a community leader or somebody in the community who likes to lead in certain way, and we ask them if they like to be the host. And I'm going to explain in a bit the different roles in the design studio of the play roles that we have in the design studio. So the host usually is a community member, but in many cases we've been asking the researcher to be the host out of convenience, because sometimes the community does not want to play that role, and we respect that. So there's no pushing at all. But it's preferred to be someone from the community to play the role of the host. And the host is someone who is really summarizing what has been said at each group in the room, and keep connecting us with a story on an experience to lead us to the next movement. So this is the co-planning stage with 2 or 3 community members. And then we have the design studio that consists of 3 movements, and these are intellectual movements. So in movement 1, we do insight identification, and we do design thinking, and we use divergence thinking and convergence thinking. It's very structured with time allocated for each movement, 30 minutes. After the insight identification, we go to movement 2, which is insight integration, building on what was identified in movement 1. And then a little short break, and then the last movement will be insight activation, the action steps next. After that, we compile from the recording a transcript plus the post-design studio survey that has open-ended questions, the note-taking that happened, the debriefing session that we usually do as a team after the design studio. All that will be combined into a report. We call it the Design Studio for Health Digest. We send it to the community members to verify, did we capture everything? And then if it's okay to go, then we finalize it and we share it with everyone who attended the design studio. And as I mentioned earlier, there's a survey that we send out either at the end of the session, or we send it a couple of days after the session to complete. It consists of 9. I'm going to talk about that in the methods slide. Any questions so far? Okay, so I want to just highlight one more thing before I go to the next slide, that usually we have a series of 3 to 4 iterative sessions of this design studio per project, or sometimes it's within each phase of the research process. So it depends on how complicated the thing that we're trying to build with the community. So the methods, we use mixed methods design, and usually when I'm working on this paper now to see how this framework helped us in the development of different digital health tools across different research topics with different diverse community members. So the research questions: to what extent is the design studio model effective in facilitating meaningful community engagement in the co-creation and implementation of digital health interventions? Our hypothesis for this study is participation in DSH sessions will enhance meaningful community engagement in co-creation and implementation. So we believe it's effective, demonstrating the model's effectiveness as an equity-centered, community-engaged approach to digital health intervention development. The data collection, so far we have conducted 14 DSH sessions over 2 years across 6 digital health interventions. Session engaged community members and stakeholders from, as I said, different backgrounds and different communities. We employed mixed methods, quantitative and qualitative, within the survey that we built on Qualtrics, plus the debriefs and the open-ended questions on the survey. On the survey, we assess 5 key metrics. We pulled them from validated surveys, and basically we selected these metrics to help us see certain areas are very important for co-creation and engagement and all of that. The group cohesion that has different items under that on the survey, facilitator performance, how they feel about trust, collaboration, and willingness to help. So I'm going to give you just a little taste. So for example, if we did like 3 design studios with 1 project, we see how collaboration was maybe above 0 a little bit on a Likert scale 1 through 5, and it went to 4.5. Group cohesion and trust, it improves with more sessions that we're doing with the community members. We do also have the qualitative data where we get the quotations from the open-ended questions on the survey. We use that also as a feedback for adaptation and assessment as well. The digest is like this. It's very visual with a lot of themes, emerging themes on it, and capturing what the host summarized after each movement. So it's very informative and detailed about what happened during the session. And every participant or every collaborator receives a copy after it's verified by members check, and it's okay to go. We get the thumbs up. So far we did the Turbo Word, which is word recognition for dyslexic students. We did Menopausal Women's Brain Health, which is in the industry. It's already now launched fully, and now they're trying to get it approved by health insurance and Medicaid, so it will be covered for women who are going through menopause and perimenopause to improve their. And I got a subscription to try it because I want to see, like, I helped with the design studio, refining all the ideas. So it's really working very well, Prickly Pear. Heat Mind, it's still at very early stages. My colleague here, Stephanie, Dr. Carpenter, and a large team were working on this, where we're trying to build an AI-powered tool to help firefighters mitigate heat-related health risks. Smart Start, Ayatayo is here. She invited me to join her at the end of last year to engage the community further and stakeholders at Wesley Community and Health Center to refine some of the available resources for the people with type 2 diabetes, mainly Hispanic with low income. And now we are moving towards what the community wants besides what's provided for them through the education program that it's offered through the clinic. And the last one is what I'm going to go into detail in a little bit, which is called Impact. And we're hoping that the impact will really have an impact. But I'm going to tell you what does it stand for. It's integrated mobile health, breast cancer prevention and action for early breast cancer detection. So I collaborated with FEMAP. FEMAP is an organization, nonprofit organization that has 2 chapters, one in El Paso, Texas, and the other one in Juarez, Mexico. and they're doing phenomenal job. They have a nursing school. They make everything super affordable, and most of the services are for free for people in Juarez. And then they do have several clinics available for the community. Now they're building the breast cancer clinic, and they applied for a grant to get their mobile mammography clinic that would for screening. So we collaborated with them, and I'm gonna tell you the truth. I saw, even though I told you that we go to the community, we hear from the community first, but I'm a human being. I regress sometimes. So I saw a call for low income, middle income NIH grant asking for a digital health tool, but very loose, like you can think of anything. But I saw there's a lot of the people like different subdivisions from NIH, from the mental health. So I immediately thought about Mexico because I do have connections in Mexico, but I thought about microbiome and mental health. If we can do a digital health tool that will really help people improve their microbiome, the gut health, because there's now evidence-based saying that if the gut health is not really in good shape, then it leads to serious mental health issues. So I went and I met with the stakeholders at FEMAP via Zoom, and then I told them that. And then the president of the organization on the call, she said, "Excuse me, Dr. Khatib, women are dying of breast cancer, and now you're telling me about gut health and mental health." And I'm like, oops. And then she told me it's the most prevalent mortality of breast cancer in Juarez. And women with low income, there are almost 2 million people in Juarez, and like chemotherapy fusion seats or chair stations, there are only 8 available in the whole city. But of course, there are private hospitals for those who can afford them. But for people who cannot afford, there are just 8 seats. And then mammography is also another hustle. They cannot really do the screening on annual basis. So by the time they come to us, it's already late stage 3 and stage 4. So the mortality is very high when it comes to breast cancer. So I took a step back, and then I said, okay, let's then plan on a design studio with women who are going through breast cancer and women who are at high risk for breast cancer to hear from them. And as you see, it's the #1 leading cause of cancer death among women in this city, Ciudad Juarez. And the late diagnosis, as I mentioned, and there are a lot of social and environmental drivers behind this, not only the economic part. So their recommendation in Mexico, woman needs to go through annual mammography. It's just age 40 and above, nothing below 40. And as you can see, 1 in 5 women at age 40 are at high risk for breast cancer. And there are 160,000 women who are candidates for early detection, but there's no access to mammography. So it's 90% of breast cancer cases are detected at very late stage. And in 2025, the state of Chihuahua and the highest death rate from breast cancer with 27.6 deaths per 100,000 women in Mexico. So it's a very, very, very critical situation that needs to be addressed. Rising mortality, it's not just is a signal, not just a statistic. We need to improve detection, diagnosis, and address the social determinants behind this kind of high mortality because of breast cancer. So when we did the design study, what we heard from women, basically, I was very surprised. I thought they need maybe awareness because they work a lot at the maquiladoras and they live in very poor areas. So I thought maybe they don't know anything about awareness. When we started talking with them in the design studio, they said awareness is not sufficient to tell us just awareness. We don't need awareness. We are very aware. I know that my grandma died of breast cancer. I know my mom get diagnosed with breast cancer, but I cannot leave my work to go do mammography. And even if I'm gonna go to where they have flexible schedules, I cannot afford it. They talk about transportation, they talk about food and health, they talk about practical way of connecting them with places that provide mammography with the workflow that they have. So basically, we took everything we've learned from that design studio and we started immediately putting something into a prototype. So this is the initial phase still. So we based on what we've learned, we started building something addressing all the things they want to have in a digital tool, but also it's a system integrated to FEMAP mobile clinic that's going to be happening soon with the mammography. And we made sure it's contextually relevant. Plus, we are also building a CIS, a geospatial thing in the digital, so at least we can also identify which areas are more stricken with breast cancer in Juarez, Mexico, to figure out the environmental factors also impacting the situation. So this is a graph just to show you comparison between the latest projects that I've been working on, a Smart Start with Ayutayo or Dr. Olabi, and Impact, the breast cancer. As you can see on Likert scale, on the Likert scale between Smart Start, the blue, and Impact, the red, the breast cancer digital health. So far, from the data that we collected through the survey, the 5 metrics are showing really high on the, as you can see, it's 4.5, it's 4.8, and so on and so forth. We got some also quotes from the qualitative data. And then what impact does mainly. So what we have built so far for the prototype, it's reminders, scheduling, clinic navigation, mobile mammography integration, lifestyle and support services. So educational piece in it as well. So we're hoping, it's still in the very early stages, so we're going to seek more funding to keep developing this digital tool. And they just submitted their also grant for the mobile mammography. We're hoping that it's a community-based education. It creates awareness and breast cancer screening. It's a timely follow-up diagnosis and referral. Everything will be coordinated between the healthcare services through FEMAP and these women with the digital health tool that they have on their phone. So integrated into care workflows designed for low resource settings and aligned with real-world behavior. So we're hoping that this tool will be able to increase the access to screening, really lower the late stage diagnosis, and really increase early detection and prevention behaviors when it comes to breast cancer. So the takeaways, I always say that start with people, not technology. And sometimes when I'm working with different collaborators, they think that, oh, why you want to do 3, 4 design studios for stage 1? Let's go faster. Let's do one. And I keep telling them, trust. Trust cannot be built in a snap. It takes time to build that trust, to make people feel comfortable and really address all the traumas that happened before because of being involved in a research and they didn't see any impact from that research. So it's a slow process, but once we reach that thing, building the trust, it's amazing how much we can achieve. So trust is built through co-creation, not consultation. And sustainable solutions require alignment with real world systems. And to align it with real world, we need real people at the table to co-create in the process. And equity must be designed in from the beginning, not added later in order for it to work. So here are some of my references. And if you want to connect with me, here's my email, but I think all of you are at ASU. You can find me easily. Thank you for your time. I hope I didn't bore you today on Thursday afternoon. Any questions?
Great. And I feel like your energy is infectious. So I don't know that any of us
Thank you.
got bored.
Yeah, this last project actually brought me a lot of joy, even though it's very sad what I saw, what I heard from the women who are going through chemotherapy. But I felt we can do amazing work through this collaboration. So it's exciting me. Where next we're gonna be doing with this project.
So I want to open it up for Q&A. You can put your comment in the chat and I'm happy to read it, or you can just take yourself off mute and ask a question to Dr. Khatib.
I have
there
a
you are.
question. Yes. Hi. I really enjoyed your presentation and I am inspired by the work you're doing. I'm newer to this space and I hear, we all hear about co-creation and community engagement, community-based
Yeah.
participatory research, and then you start to wonder how many people are actually doing it and like, they're buzzwords, but it sounds like you're actually doing it and you're doing it well. And I'm just curious. I'm trying to think how to best ask this question, but I guess what would you say are maybe common pitfalls or maybe best practices on the flip side in terms of how do you the actual pragmatic process of engaging with communities? Like we say co-creation, but how do we do that? Because I feel like sometimes, especially if you work with multiple community partners, they may have insights and ideas that are wonderful, but maybe just not possible right now, or maybe from a scientific perspective, are just not a good idea for right now. How do you manage that process, that back and forth process?
I would say the biggest thing is real empathy and passion. That's the first tool, empathy and passion. And to strongly believe in the pace of, as I mentioned before wrapping up my presentation, that trust takes time. And I know some faculty members that are on a clicking clock, especially on tenure track. So this also, academia has to change. Federal agencies, they have to change with the timeline. Because if we really want to do impactful work, really create health equity and really help people improve their health, we need to change the pace of things we do. So if I need to engage with the community first, maybe I need several times to meet them where they are through an event, through a community organization thing. This takes time. And I cannot expect anyone who is like on a tenure track, they will spend like a year just building that relationship because they cannot. So I think academia needs to change to maybe hire people like me or somebody else where they can support people who are on the tenure track or even tenured, but they don't have the time to do this. They believe in it, but the system in academia doesn't allow them to do it. So this is where we can really help and support and create those kind of connections and spaces for people to co-create. There are plenty of tools out there, but now I feel there is also a need, especially here at ASU, to find something where we can build like a space, digital space for resources, videos, handouts, articles. So this is now in the making. So we're working on this. I hope I answered your question.
Oh, you did. Thank you very much.
The other Stephanie, I saw your hand raised.
Yeah, it was kind of a related question. We talk, Maissa, about how, one of the goals, and it's interesting because I think about this a lot, and obviously you and I are working on a lot of projects together using design studios. And we just did a workshop together at SBM on using these types of methods with like optimization methods. So, definitely I'm bought into this idea. But what I want to understand is, if we're talking about the average 17-year gap, right, between like the beginning of research to the point of implementation, and co-design work is slower. So one of the things that when I've been working with other colleagues who aren't used to this space, they're always like, it's too slow, it's too slow. We got to find ways to speed it up. Maissa and I are even having that happen with a project now. And so I'm curious, like what your thoughts are, Maissa, and how we can balance this co-design process, which, should actually be a little slower because you need to build the trust and you need to take the time, and recruitment can take a while and all this stuff. But it's hard when there's pressures, right? To like, we don't want it to take 17 years for a solution to actually get implemented. So what are your thoughts on this?
Yeah, my thoughts, maybe when I said slow, like to co-creation is a slow process because you need to build trust. But let me tell you this, once the trust is built, like for example, we have a good connection, let's say, with the group we're working with, Women in Juarez, Mexico. and the organization FEMA. So we have this sustained relationship already. It took time at the beginning to build it, but now if I know Stephanie is very interested to come and add this to address women's health in Mexico. So we're not going to start from zero. It's an established relationship. They trust us already. The minute we engage with them, it's going to go so fast because it's the input from the community and we're building with technology. So it's fast. It's not. So it depends on what community you're working. If it's first time we're collaborating with this community, yes, it's going to take time. But this is why I think the more we do this work, we're going to have this kind, if we work on it like really sincerely, with a lot of transparency, we can sustain these relationships so it becomes not as slow as from starting for the first time. So this is what I would say. So it should go fast. Now with Tayo, for example, I started with her last October of last year. It was a bit slow, October, November. We did 3 sessions from October to November. And then we picked up again in March this year. Once we invited them, it's amazing how much they moved the thing around. And we did another one in April. Now, Tayo, I'm sorry, I'm exposing your stuff, but I'm not going to share a lot. But she has a lot of valuable lived experience captured. She's ready to move to start maybe with a prototype of something. So it didn't take that long from October to April, like how faster than this it could get. But because we built that relationship, she had the relationship with them, of course, before she invited me to join her. But with the design studios, and I didn't get the chance to tell you. So we set up the session. We make it like your family in a living room or around kitchen table. So it's food. Yes, the screen that's up there, it's very structured, but we make it super comfortable and safe where people feel they're engaging with family members or community members around a kitchen table. So, they always leave like so happy. And then when they do the survey, you see how much beautiful feedback they give us. And we listen for the feedback. Like somebody said, if you can cut it short, 2 hours like of discussing these questions. So we went and we really, on some of the projects, asked them like, what is like a good time for you? It's not like, and we asked the rest of the group. So they said an hour to 30 minutes is enough. So we adapted. So we listen and we adapt. That adaptation also helps a lot. Like now with the Heat Mind, today we had a meeting with Community Advisory Board. They advised us, we did 2 sessions. They advised us to cut it short also. They don't want the 2 hours. And they asked us also to provide different formats, hybrid, completely online, to allow firefighters be able to engage with us. So we're going to do that. So we listen and we adapt. That's the beautiful thing about the design studio. It's so adaptable. Yes, Dr. Owolabi.
Thank you so much for the beautiful presentation. I think
Thank
I
you.
was going to ask you questions about that adaptation because when
Ah,
you started off your presentation, you told us about the importance of getting these people involved from the very beginning, even before you conceptualize these ideas. But
yes,
sometimes it's just not feasible in
yes,
this kind of space that we are. And I was thinking about your presentation and my situation because I know that I already had the grant already before I
yeah,
even involved you in this grant. So I wanted to point out that adaptation is possible and in terms of how we use these design studios for health. And I was going to pose a question to you, like you talked about digital health intervention. Do you think design studio is only for digital health?
no,
Because
no,
because I was thinking about my own personal example. I came in
yes,
with this grant, you adapted
yes,
your framework to fit my need because I already had this grant. But from these design studios, we already see how all those information they are sharing is going in different ways. And our
yes,
most recent design studio was even moved away a little bit from the digital health now, because from the very first session we had, we were thinking digital health, while these people were thinking, yes, that's cool, but we also want to gather together. We want in-person, community-based social support. So we moved away from digital health now. We had design studio about that in-person social support. And I do agree with you in terms of how things can speed up over time as we build this trust. Like I tell you, for the all the sessions we've had the same people show up for those 4 sessions. And then for subsequent sessions, they bring more people, they bring their family members, and they keep telling us, you told us 1 week ago about this new date. I wanted to invite this cousin of mine, but the time was short. You can see the interest in building things and even us as researchers too, because the new idea of in-person social support came in, and we were able to leverage those same set of people to build that new idea. And again, proposing another idea now, still going back to the same set of people to help us refine it. So yes, it's maybe slower, but it's worth the investment if we can do it. So I
Yeah.
don't know whether that was a question or a comment or a combination of
Yeah, I
questions
want
and
to
comments.
say the focus today of my talk was about digital health because this is what I submitted for SARC. And I need to honor them because I said this is what I'm going to talk about. But Design Studio is basically about community engaged research, how to create the space for the community to engage with you and make them partners. It's about partnership with the community. Whether you're building an intervention, doesn't need any digital health tools, but in anything you're aiming for, uh, when you include the voices of the people who are you're trying to build an intervention for them, whether it's a regular intervention or a digital health intervention, makes a big difference because they're crafting it with you, where they really tell you nuances about their life, daily life, about challenges that they face we from outside we will never think of. And you know, Tayo, how much we've learned when you even put that chart on the wall at the end. She asked them to put whatever they think elements they like to see in this community support group. The things they've listed, I think Tayo and I we were astonished like how much like they were very creative and really came up with things that we've never thought of, like the Zumba class. They want to dance together to help manage their diabetes. Zumba class together. They want to cook together. They want to adapt their food to make it really supportive for their management of type 2 diabetes. They don't want new recipes and this and that. And they want to make it like celebratory to really help the kids and other family members learn from this. So a lot of elements they added there on the chart was really an eye-opening. And as Tayo said, even though we're hoping like to move to a digital health to make it more accessible, they're taking us, the community partners, in a different direction. And we're fine with it. And I think she's fine. I'm just facilitating. Dr. Olabi is very fine. So because she's really want them to own the intervention to help them with their type 2 diabetes management. Thank you, Tayo, for your comment.
I think that would be a fascinating presentation to really
We cannot hear
show.
you. Your voice is so far. Am I right?
Can you hear me now?
Yes,
Yeah.
that's better.
I always have an outside voice, so I'm surprised you can't hear me. No? Okay. Let me see if I can fix it. One moment.
It's better now.
Okay, I'm gonna stay like this then.
Yes.
I think kind of going off what you and Tayo have been working on, I think that's a really important presentation to share with other faculty, to like when you listen to the community, it may take a shape that you're not expecting. And I think so many faculty hold on to like, this was my idea. This is what we're doing. We are doing this digital health thing. And so I really applaud you and Tayo for kind of really listening to the community and taking it where they want to go. And I know that's not easy for us, and especially those of you on the tenure track. That's scary to be like, no, I got to get the pubs and I got to do this and that. And so
It's tough. Yeah, it's tough.
yeah, so I just want to really applaud both of you. And Tayo, I'm looking forward to that presentation soon because I think that's fascinating. But I really just appreciate that circle, that feedback loop, and to really honor what the community is saying and allow yourself to not be the
And I
smartest
want to
person.
be very, very sincere here. So yes, the whole thing framework we do is to step back from the power hierarchy and to deeply listen to people and let them lead the innovation or the intervention. But even me, even I'm helping the researchers to do this and that and facilitating for the community. Sometimes it's challenging for me, like the digest, because we all we stick to what we do sometimes. And I'm gonna give credit to Tayo here. So we do the digest, the report in the same format, and then during the last, I think the March one, am I right, Tayo? Design Studio on March 28th. So
Yes.
she wanted the findings from the chart they wrote on two groups. She said, I want that to be captured in the digest because they wrote it. And I'm like, but we don't include these things in the digest. But then when she told me this in the evening, I started thinking, I'm like, shame on you, Maisa. Like, why not? It's a little adaptation of the template to show them we captured everything they shared with us. Then I went back to Tara. I said, you know what? Let's just like, I cannot have images, but let's put the findings in a table and include them in the digest. And I was very happy that I changed my mind. But even me, who was really pushing for community engaged research that it should be done properly, sometimes we are challenged. I'm challenged myself, like I cannot, oh no, they just has to be like this, and we cannot. So sometimes, yeah, we need to adapt ourselves as well, be flexible, because when we're having that trust from the people to open up and share with us, we need to have the flexibility to embrace everything they're sharing with us.
Yeah, and I wanted to add to Stephanie's point on how this is hard for us as scientists, because myself, I'm questioning myself and I'm asking, hey, your probationary review is this year. What are you going to tell them? Are you going to tell them the story of how you're going back and forth and everything? But I feel like it just takes, like, you just cannot ignore them when you hear them talk, because you just cannot ignore them. And sometimes when we have these design studios, they don't even think about the fact that you are collecting data as a scientist, because that's what I'm there for, right? I'm there to collect data. But they themselves, they see the data collection as their own support group. And I'm like, hold on, guys, this is not your support group yet. We're not even there. I am here to collect data that I have to report back to the grant. Yeah, but I know that my main grant is a little bit slowed down, but at the same time, it calls for creativity, right? So I'm
Yeah.
busy thinking as a researcher, okay, what can cover up for this delayed one in terms of everything that we are coming up with. So yeah, it's not gonna be like a straightforward process. It's a win-win kind of situation sometimes, and you have to just be creative as researchers because yes, they want those publications, yes, they want those creativity, but what can we do? How can we still balance this, making impact at the same time being productive? Yeah, it's
But
quite
I want to
challenging.
tell you something, Tayo. Maybe this first phase that you did, you got delayed a little, and now you're puzzled about how you're going to report during your annual review. But think about how much you have really learned from this community, where when you're going to apply for a larger grant, you're going to base it off that, and that will give you a lot of push and you're not doing something like it's not going to help the community. You're even advocating for the community by seeking a bigger grant to do more, but it's based on what you have learned from them. So it's giving you such a strong leverage to be a very competitive, to submit a competitive application.
I think maybe to Tayo's point, it can be challenging because, and Edson's process is probably different, but like with the College of Health Solutions, it's so interdisciplinary that like it's hard to explain for, and everybody is on the personnel committee, right? And they all write the letter together, and it's hard to explain to like somebody in biomedical informatics or. I mean, we have the privilege of working closely with Hassan, and he's bought in. We've um, we've recruited him to the co-design world, but most people in that area are not, right? Or econ or, the basic sciences. So it is a really different. So I hear what you're saying, Tayo. I mean, I think part of what you have to write about in your letter is what Maissa is saying, and you have to kind of say for people who work in co-design space, right? I'm making good progress. Look at all the metrics that I'm meeting, and it's setting me up for success. But I hear you. I just went through that process.
You for confirming that. I don't regret it. I'm pretty happy about it because I already see even potential grants like Maissa said. And it's always also the most challenging part also is turning those ideas into an actual research, like a actual research that you can evaluate rigorously. So I'm in that process now, like, oh, they've developed the social support, but how do I so instead of running with their social support that they wanted to do, I have to be creative to make it that it's a research kind of way and I can evaluate it rigorously. So I think that's where all the support into collaborations and you just throwing your ideas out to people and hearing how people help you shape this thing comes into like play. Yeah, I'm happy that they brought it up, but I'm personally so the last session they were like, when is the next one? When are we coming back? And I was like, well, usually if I know that I'm doing this next time, I would try to get the date for the next one right there. So when are you guys available? Pick a date on out of these three options. But this time they were like, when is the next one? So I'm like, no, we have to calm down. We have to look at the data and make sense of the data and make this a meaningful one. So we'll get back to you. So, just being adaptive again.
That's
But
a
I think,
good sign, but that's a
yeah.
good sign. They're
Yeah, it
enjoying.
is. It is that they really want to come back, but at the same time, reminding myself, like, no, I am not just gonna say you're coming back in 2 weeks because they want to come back, but at the same time, I have to do it in a way that is meaningful to my career and also my purpose, my research. Yeah,
Yeah,
so those are all the balances that we have to make.
yeah.
I have a maybe kind of difficult question, maybe sort of relating a little bit what you have already been talking about. And that's, I think all these wonderful things that you all have experienced and described and all make sense. I think one of the challenges that I have experienced, and not only when working with community partners, but also I think in general when we sort of ask for feedback or input, is that if we don't set it up correctly, we might get suggestions or brainstorms that we can't deliver on, right? Or that are actually things that we already know are not working, right? Like people want, oh, I don't know, let's do yoga in schools. But we know that is, or I'm not sure for this specific example, we might know for certain kinds of activities or interventions that they're actually not evidence-based. And so I'm wondering if you have any advice on how to deal with that, or maybe how do we set up these kind of co-design sessions so that we don't falsely promise something that we will do that we can't or don't want to or shouldn't be delivering on. Do you understand what my question is?
Yeah, I didn't get a chance to show you how we prepare for the design studio discussions. So it's behind the scene with the host, usually is a community member, community leader, or the researcher like Tayo and Stephanie. We brainstorm the questions, and this is where we really think about how we're going to structure the question in a way that it's, yes, open-ended, where they can share their lived experiences, but go in this direction. And then we have printed out probing questions at the table for the facilitator at the table to keep bringing them to which direction we want them to go through. But in case, because it's not a controlled thing, so in case these things happen, that's the beauty of the framework Design Studio, because you compile everything in the digest, you send it to them, they verify it and they check it, final approval, we share it. But then the next Design Studio, it's building on what happened in Design Studio 1. And this is where the host would say, you shared with us in the previous Design Studio, but based on research, this did not work. So transparency, this communication back and forth gives them that kind of comfort and safety that we shared with you this, but you're telling this doesn't work. So this kind of ongoing, like it's a successful relationship between two, which is open communication and transparency. This is what I want to say. But usually a lot of structuring happening with the questions. But yeah, very good question.
No,
Thank
that
you.
makes a lot of sense, and that it's actually an iterative process and
Yes,
not a
yes,
one-time,
yes,
give us
yes.
some ideas and then you leave.
Yeah,
I think that's
yeah,
an important point. Thank you.
yeah. Thank you.
Well, this hour flew by. First, I want to thank you, Dr.
Thank
Khatib,
you.
for presenting. It was fascinating. And
Thanks.
I learned a lot. And I really enjoyed our discussion we had. The small group discussion was really nice. And for those of you, well, all of you are SIRC faculty research affiliates here in the room. This is our last SIRC activity for the semester, but we are going to be planning things in the fall. So please stay tuned for those of you, taking off for the summer, escaping the heat, hopefully. We'll be back in the fall. Sabrina will be on sabbatical in
Oh
the
no.
fall, so you will not see her. You get to see a lot more of me, good or bad.
Good, good. And I
Um,
hope that you're planning good things for you, Sabrina. Don't work when you're on sabbatical.
I
No,
agree.
I have to work. I have it's not vacation, sabbatical. It's actually a research project. So,
Okay.
but still more flexibility, less structure,
Yes. Yes.
less on
Yeah.
my plate.
Good.
Thank you.
Good.
And Maissa, will you stay on for 1 second with me?
Sure. Sure.
But I want to thank you all for being here and joining us today.
Thank you for joining
Thank
me.
Thank you, everyone.
Bye-bye. Now look at Tayo.